Welcome, everyone. I'm Serena Shadeen, the Executive Director at the Lloydminster Chamber of Commerce, and I'm joined here with Lorelee Marin, the health promotion facilitator. So Lorelee, please tell me a little bit about your job and what you do.
Well, there's nothing I love more than talking about the work I get to do in community every day. And so I'm a health promotion facilitator in addiction prevention and mental health promotion. I work with Alberta Health Services, and my position is in Lloydminster, and I cover Lloydminster and the County of Vermilion River, as well as the town of Vermilion. So that's my region. So the work is really designed by community. So I get to do different work in different communities based on what their needs are. So I do a lot of work in creating partnerships in community, helping to understand what are the issues that community might be facing, what kinds of supports could we bring in and provide for them in terms of building skills and knowledge around how to promote mental well-being, how to prevent addiction use or substance use. And so it does look a bit different in every community.
So what communities are necessarily all in your area?
So my big communities are the city of Lloydminster and the town of Vermilion, but then I sometimes go out to Clandonald or Dewberry. I've been out to Kitscotty and Paradise Valley. So all of those little communities, they also need to have supports and some education and knowledge and resources. So when they don't have a clinic available to them, then I kind of fill that gap for them and make sure that they know how to access the resources they need and that they have tools available to them to support good well-being.
So what does a typical day or week in your job look like?
Well, the best thing is that every week looks different, and I've never had 2 weeks the same. But I can talk about some of the specific work that I've done, and I think I'll continue to do that work. So a lot of my work is in schools. So I'll go into a school community and I'll do presentations to students. Sometimes I talk about mindfulness, or I might talk about, I have a program called Have a Game Plan. And so if you're going to use alcohol or drugs, you need to have a game plan. What are you going to do? And really promoting that good decision making. And we always hope, I always say to the kids, I would, if I could choose for you, I would choose that you don't use any substances. But if you do, you need to know some things to keep you safe and to reduce your harm. And so it's really important that we give kids good information so they can make a good decision for themselves. And I always hope that that decision is to choose not to use tobacco or vape or alcohol or other drugs. And so I also do a lot of work around suicide prevention. So how do you recognize when someone is at risk of suicide, when they're not doing well? Maybe they're not thinking about suicide, but they're just clearly having a difficult time in life and experiencing some crisis. And so how do we recognize that? What are those warning signs? And then how do we help them through that? So we want to make sure that kids in our community have those skills as well. So if a friend of theirs is changing in their behavior and they're worried about them, that they know to go to a trusted adult to ask for help. I also do professional development sessions for school staff. And so that can look very different based on whatever the needs of the staff are. But I'll go in and teach them, things like mindfulness, how to use that in their classroom. I might teach them around recognizing the signs of suicide and then what kinds of supports could they give. And I teach psychological first aid as well. We have a new program called the Self-Care Toolkit. And so we're teaching organizations to adopt a self-care practice for their staff. So how do you know what are those red flags for yourself or for your workmates to recognize that maybe they're not doing well, and how do you support them to engage in self-care? So that's some of the new work that we're doing. Then I work with community agencies, and we often have something called a coalition. So it's a collaboration of many community organizations or agencies where we work together to identify the issues in the community, to talk about what are the needs that are missing in the community, and then how do we collectively address them. So I have Early Years Coalition, I have the Lloydminster Area Drug Strategy, our community name is more recognized as YLL My Home. And our vision is to create a community where kids can grow up great, every kid, every day. And so we do lots of work in community to support that vision. One of the things that we do in Lloydminster, and we talked about doing it in other communities, is we have the Lloydminster Youth Council, where we have a group of kids where we're really just investing in building their developmental assets so they can invest back into community and experience success in life. And so that's been about 6 years we've been running that program with great success. What else do I do? Oh, I develop resources. I'm just thinking because, it's so different all the time. It's not the structured workplace. I develop resources. So I spend quite a bit of time working on research to see, if we're going to develop a new program or develop a resource, doing the research to make sure that we develop that resource or program based on really good evidence. And what are the best practices in terms of delivering that or developing a program. And so some of my time is spent doing research. I do lots of learning as well. So taking other courses to help support the development of those programs. And I write resources. Sometimes they're print ones, sometimes they're programs like a Move Your Mood program. So it's an activity program for children and youth to help them move their mood. So it encompasses lots of different things. So there's a lot of different work that happens. And then I sit on some provincial committees. So looking at alcohol-related harms, creating a toolkit for communities to reduce alcohol-related harms. I worked on the Cannabis Let's Talk initiative. So there's just a lot of different things depending on what's happening in our world at that time and what's happening in that specific community that we get to do.
So another big project in Lloyd that you've been involved with is Project Sunrise. So that just kind of came up just in the past couple of years around mental health, which is a very important topic that we have some supports out there for. So would you mind elaborating a little bit on Project Sunrise and what that is?
I'd love to. So Project Sunrise came to be because we recognized that many people in the community weren't doing well. And we had experienced a number of suicides. And so we wanted to create this initiative that would help people to see the next sunrise. So how do we get them through the evening and through the night when things are really hard and dark for them to the next morning where supports, the offices open up and supports are available to them. And so part of that was looking at a needs assessment. So we learned from the community what kinds of things that were missing in Lloydminster. And then Project Sunrise committee started to look at what's missing and how do we fill those gaps and make sure that people have good access to resources, the right kinds of resources, and timely access to resources. So one of the things that we worked on was we recognized from community conversations that many people didn't know what are the resources in Lloydminster, how do I even access them? If this is how I'm feeling, should I reach out for help? Am I in a position where I actually need to get support? And so we developed the Lloydminster Mental Health Navigation Tool as one of the initiatives for Project Sunrise. And that has a collection of resources to help people learn more about mental illness, mental health, addiction use, or substance use, which we often refer to as addiction, around suicide, and also things that they can do to promote positive mental health for themselves. And then we have a section as well on reducing stigma. So how do we adopt good language and reduce the stigma around people living with a substance use disorder or a mental illness? And so there's all that learning in there. But the real big thing is we have this directory of all of the resources that are available that can support people to get access to the help that they need. And it has a descriptor on it. So we have a booklet, and many of our agencies have copies of those booklets. And we did have them out in public everywhere, but we can't do that right now, but we will again. And then we also have online. And so that's a really well-used website. It's lloydminstermentalhealth.ca. And I just encourage people to go there, even if they're doing well right now, just to understand what's on there. We have some strategies to well-being, so things that you can do that can really promote positive mental and physical well-being as well.
So if there are any students out there who want to get involved in this field within mental health, addictions, counseling, all that type of stuff, what are the options out there? Like, it's a very vast field. I'm assuming, if somebody wants to get a 1-year certificate all the way up to becoming a doctor, that there's like many options out there. So, I mean, what's available in this field for employment?
Yeah, so there's a lot of opportunities for employment. Some are very entry level where you might work with an agency in supporting the implementation of a program or being part of supporting a program. You could be a social worker or a psychologist. There's lots of agencies like the Thorpe Recovery Center that has addiction counselors that work right in their facility. They also have social workers, and they have some entry-level staff, so they might have a certificate or they could have a diploma and then working towards a degree. So there's some great agencies in our community with opportunities that come up very often for people working in this field.
Sounds good. So I forget, did we cover it already? What's your career path? What led you to where you are today?
So I have a very different career path than many people that I'm working with today, but I was a banker for 10 years and I thought I was going to do that forever. And then I stayed home for 10 years. And when I went back, I was like, I wanted a different focus and I really wanted to be more involved with like social work and people. And so my background is in community development and community engagement, healthy public policy. And so I spent about 12 years working for an organization doing healthy public policy and support for people living with cancer. And then I moved into the world of mental health and addiction. And so it was a nice transition for me, but all of those experiences along the way, I think for young people to know that they might decide to do this and then it might transition into something or another passion down the road, or opportunities come along, and it's a great way to kind of get lots of different experiences. But all of the work that I've done has kind of prepared me for the work that I'm doing now. And so I feel really fortunate to work in this field. I think the other thing is when you're in the field, so on my team in Central Zone in Alberta, we have mental health therapists, we have addiction counselors, we have social workers. I'm a community developer, and we have someone with a recreation background. And it's very cool to see how we all bring our knowledge and skills together to create really wonderful programs for the community. And we have this talent list. And so if we're working on a project and we think, gee, I need somebody who has expertise in the 40 developmental assets, I can go to the list and find out who. So I think whatever career path you take, this is an opportunity that can be wide open for you if it's an area of passion for you. So we kind of engage with lots of different types of education.
Okay, awesome. Is there anything I missed or anything else you want to add in before we wrap up?
Well, I think I would like to talk a little bit about a few of the projects that we've done in the community as well. And so if you are interested in looking at what kinds of resources have been developed, and when I talk about resource development, what would that look like? And so we've done things around building resilience for families. So that's an initiative. If you Google building resilience, it will pop up for you, or simple connections, stronger families. We have people who work in departments with us. And so they're working on our teams in Alberta on mental health and addictions, but all they do is that resource development, so that research piece. And then they partner with us in community to actually work on what does that look like in real life piece. So I think that, if you're more of a writer and you're not really wanting to be out there doing presentations and working with communities, that there's still great opportunities for you to make an impact in mental health and addictions.
Okay, awesome. Well, thank you so much, Lorelee, for joining us today.
It was my pleasure. Thank you very much for the invitation.